brain stroke, cerebral vascular accident. It is due to the obstruction in the flow of the blood towards the brain tissues. It is of two types: ischemic stroke and second is the hemorrhagic stroke. Ischemic stroke is produced obstruction of the blood stream in the brain due to production of clot or thrombus formation within the lumen of the cerebral arteries. Whereas in hemorrhagic stroke, there is leakage of the blood from the weakened walls of the cerebral vessel within the brain tissues. So, in both types of the strokes, there is deficiency of the oxygen and the nutrient supply towards the various centers of the brain, performing the different duties in the human body. The brain of the human body consists of three parts: cerebrum, cerebellum, and the brain stem. The higher centers of the humanity, they are existing in the cerebrum. Cerebellum is at the posterior end and the brain stem is connected with the spinal cords. So the various stimuli which are transmitted from the various parts of the organs and the bodies towards the brain, that reaches in the brain, and then these centers has been allotted different duties within the brain, and they interpret these sensations or the orders which has been conveyed for interpretation in the brain from the periphery, and then necessary orders, they are passed through the various nerves towards the organs and the outside, the parts of the human body. So it is a very complicated, very intricate process, and astonishing one. That is the great miracle of the God which has been bestowed to the human being, which has been gifted to the human being by the Almighty God. The cerebral stroke, cerebrum is consisting of two parts, left and right hemisphere. So if cerebral stroke or brain stroke is inflicted in the left hemisphere, the symptoms of the disease will be indicated in the right side of the body. Whereas if there is stroke of the right or the left hemisphere, the symptom will appear in the opposite side, that is the right side of the body. Vice versa. Then if left is suffering from the stroke, the symptom will appear in the right side of the body. If the right hemisphere suffers, the symptom will appear in the left side of the body. So these are unilateral distribution of the effects of the stroke. So in this disease, it is a medical emergency. Without loss of time, we have to seal up the cerebral vessel to prevent the further bleeding and to wash out the accumulated blood in the brain tissues to relieve the pressure and restore the nutrition or oxygen supply to the sufferer area. Similarly, we have to remove that clot or thrombus obstruction in the blood stream which is going to provide necessary nutrition towards the brain tissues or the brain centers. So this is the basic principles we have to adopt immediately without loss of time. There is facial drooping, there is weakness of the arms and legs, there is slurring of the speech, and there is imbalance of the gait. And the time factor is very important. Without loss of time, within few hours, you have to provide immediate IV therapy to remove that or break down that clot producing obstruction and to seal up the leaking vessels. So this is the basic principle in the treatment of the cerebral or the brain stroke. Similarly, the main function of the cerebral cortex or cerebrum consists of the higher thinking centers of vision, center of hearing, centers controlling the process of swallowing, chewing, and defecation, urination. All these higher centers, they are located in the, that is the duty of the cerebrum. Whereas cerebellum is the controlling of the muscular coordination, movement, and especially the gait of the and the walk of the person, and to control the balance of the locomotor system or the balance in the posture and the gait of the person. Whereas the brain stem is connected with the spinal cord and control the blood pressure, heart rate, and the respiratory rates, etc. So this is a brief description about the function of the three parts of the brain. Overall, the main symptoms appears due to this stroke. There is throbbing headache, there is blurring of the vision, slurring of the speech, imbalance in the gait, the reflexes of defecation and urination is suffered one. Then there is, the disturbance in the cognitive functions, thinking, and the emotional factors, they are also suffer in this disease. And especially there is depression and anxiety is produced due to the stroke of the brain. So these are the main symptoms which are produced in this disease. That is, there is paresis and paralysis of the muscles and the organs, especially unilaterally. So this is the brief symptoms produced in the brain stroke.